One of the biggest surprises for people who want to retire in their late 50s or early 60s is this. The cost of health insurance often becomes the single largest expense between retirement and age 65. Here's the part most people don't realize. If you retire before Medicare begins, the way you structure your income may completely change what you pay for health coverage. Two retirees with the same net worth can pay dramatically different premiums because one understood how the rules work and the other one didn't. So today, let's walk through the strategies that may help you afford high-quality health insurance without delaying the retirement you've worked hard for. Hi, I'm Jason Solomon. I'm the owner of Tactical Investment Advisors, and today I'm going to walk you through several financial strategies that may help you manage health insurance costs if you plan to retire before age 65. If you find this helpful, please like our video, comment, subscribe, and it'll help more people find these educational videos. The real cost of health insurance between age 60 and 65. When people retire early, their biggest concern is often investment income, portfolio withdrawals, but the more immediate challenge is actually healthcare. Because the moment you leave your employer plan, the economics of insurance change very quickly. So between ages 60 and 64, there's several factors that converge. Health insurance becomes more expensive because of age-based pricing. Employer subsidies disappear. Premium tax credits under the Affordable Care Act depend almost entirely on income, not your net worth. Out-of-pocket costs can vary significantly depending on the plan you select. So as a result, some retirees may see premiums ranging from $700 to $1,500 a month, depending on the state, the plan, and of course, the income that they report. This is one of the biggest reasons people delay retirement. It's not because they can't afford to stop working, but because healthcare numbers feel unpredictable. Here's the good news. The income you earn in retirement is often flexible, and with careful planning, your premiums may be far more manageable than they appear at first glance. Why your income matters more than your assets. Look, this is one of the most misunderstood parts of pre-retirement planning. Under the Affordable Care Act, the cost of your health insurance premiums is based on your modified adjusted gross income. It's not on your net worth or your total retirement savings. This means two very important things. You can have millions saved and still qualify for premium reductions if your income is structured intentionally. You can have a modest portfolio and still pay high premiums if your income is higher than necessary or poorly coordinated. This is why planning becomes so important between ages 60 and 65. Your income for ACA purposes includes your IRA, 401k withdrawals, capital gains, dividends, Roth conversions, part-time or consulting income, withdrawals from certain annuities, and a few other areas. And the ACA subsidy curve is steep. A seemingly small increase in income can cause your premiums to rise sharply. And that's why your withdrawal strategy, more than your net worth, can be more of a determining factor in what you pay for health insurance during the Medicare years. Use tax-efficient withdrawal sequence. You've got to use a tax-efficient withdrawal sequence. One of the most effective ways to control healthcare costs before 65 is to structure withdrawals intentionally. For many households, this means drawing first from taxable brokerage accounts, especially those with low realized gains, using cash reserves built up before retirement, keeping IRA or 401k distributions deliberately small, being thoughtful about realizing capital gains, avoiding unnecessary withdrawals that raise income beyond important thresholds. This doesn't mean living on an uncomfortably low income. It simply means generating income in a way that avoids unintentionally inflating your premiums. Here's a simple example. If your projected income is $70,000 a year, your premiums may look one way. But if you reduce taxable income to $48,000 through careful planning, you may qualify for significantly lower premiums, even if your lifestyle doesn't change. Same portfolio, same retirement spending, different costs for healthcare. The difference is strategy, it's not sacrifice. Another strategy is the partial Roth conversions in your low-income years. Roth conversions can play a meaningful role in long-term tax planning. They allow you to move money from tax-deferred accounts into tax-free accounts, which can reduce future required minimum distributions and lower lifetime taxes. But before age 65, conversions require caution. Why? Because conversions increase your MAGI, your MAGI, and therefore may increase your ACA premiums. It doesn't mean conversions should be avoided. It simply means they should be timed intentionally. For example, converting smaller amounts over multiple years may keep you below premium cliffs. Early retirement years. before Social Security begins may create windows of lower taxable income. Converting during market pullbacks may reduce the conversion's impact. Spreading conversions across several years may help minimize the premium impact while still reducing long-term tax exposure. For some retirees, a mix of modest conversions and careful income management may reduce taxes later in life while keeping premiums reasonable today. This is an area where working with a financial professional can make a meaningful difference. The rules aren't overwhelming, but the nuances matter. Bridge coverage through retiree health plans, if available. Some employers, though fewer in the past, offer retiree health coverage that bridges a gap until Medicare at age 65. So if your employer offers this option, it may include group pricing, lower or more predictable premiums, a smoother transition from working years to Medicare, coverage for a spouse in some cases. If you're nearing retirement, this is something worth confirming with your HR department as well as your planned retirement date. Many people don't realize that these programs exist until after they've already left their employer. Another strategy is using an HSA as a pre-65 healthcare bridge. So HSAs, health savings accounts, they can be one of the most valuable tools for people retiring before age 65. They offer 3 unique benefits: tax-free growth, tax-free withdrawals for qualified medical expenses, and for retirees, this means an HSA can be used to offset deductibles, copays, prescriptions, or other qualified costs during pre-Medicare years. Here's a detail that many people don't realize. After age 65, HSA withdrawals for non-medical expenses become penalty-free. They're taxed like IRA withdrawals, but without the early withdrawal penalty. Before 65, however, the 20% penalty for non-medical use still applies, which means using the HSA for qualified expenses during the pre-Medicare years often delivers the most value. Use a 3 to 5 year income glide path until Medicare begins. So for retirees leaving full-time work at age 60, 61, or 62, building a short-term income glide path can be one of the most effective planning tools. A glide path is simply a structured approach to generate an income during the pre-Medicare years. It may include 1 to 3 years of cash reserves, strategic withdrawals from brokerage accounts, controlled realization of capital gains, low intentional IRA or 401k distributions, flexible spending that adapts to ACA subsidy limits, careful coordination with your planned Social Security start date. This glide path may accomplish several key goals: keeping your income within favorable ACA subsidy ranges, managing taxes, avoiding unnecessary early withdrawals from tax-deferred accounts, preparing for required minimum distributions, protecting your long-term portfolio longevity, reducing Medicare premiums once you reach age 65. For many clients, this window between 60 and 65 is one of the most important and overlooked opportunities in retirement planning. Here's the emotional side. Healthcare costs don't have to delay retirement. What we often see is this emotional shift. People assume retiring before 65 is too expensive because healthcare feels unpredictable. But once you understand how the system works, especially the income rules, you start to see that early retirement may be more realistic than you thought. And so for many households, a combination of a planned withdrawal strategy, thoughtful tax management, a structured glide path, realistic understanding of the ACA rules, these can make an early retirement both achievable and sustainable. The transition from employer-based healthcare to private coverage is one of the most important planning challenges for early retirees. With the right structure, it can be managed effectively and without derailing your retirement timeline. The goal isn't to minimize spending at all costs. The goal is to protect your lifestyle while ensuring your retirement plan continues working efficiently and intentionally. If you're approaching retirement and you want to make sure your plan is working for you, not against you, let's talk. Click the link in the description below and book a free consultation. We'll walk you through your options.